we just went through and we identified the rules that as a parent you came up with for timeout. Before we practice having you put someone into timeout and practice that situation, I want you to share with your child what your rules for timeout are. And this is again something we would have our parents, we would instruct our parents to do with their child. So if we're having kids come into session to work with the parents, we may have had the parents identify the rules ahead of time, practice, make sure that there are definable, behavioral, observable rules, and practice being the child and having them tell us the rules and then having them do that with their child so we know they've communicated those rules. For the instance of our role play though, we're going to have you first share what your rules are for timeout with your child so they know whether they're making them or breaking them, and then we'll go through and practice. So again, may I have the three of you partner together, and I'll allow among the three of you to decide who's going to be the parent, who's going to be the child, and who's going to watch, but have the parent inform the child of the rules. Do you have another one coming? You're going to do three? Same thing. So who's the parent, who's the child, who's watching, and parents share the rules with the child. And I'll have the two of you, and two of you, if that's okay? Okay. May I have the three of you work together? Same directions. The two of you and three of you, or however you want to break it up. And then we'll have the three of you and the two of you, if that's okay? Okay. So whomever is the parent, please inform your child of what the behavioral rules for timeout are, but don't start role playing yet. What I'm going to have you do for your first role play is the child is going to be non-compliant. So parents, you will be giving your child a direction, and I'd like you to practice using the good command strategies that we just reviewed, but you're going to give your child a direction. Child, you're going to be non-compliant. You're not going to be outrageously non-compliant, you're just not going to do what they say. So kind of passively non-compliant for this first role play. Okay? Parents, your job is to inform the child that they didn't listen to you and reissue the command. And kids, you are going to passively be non-compliant again. So you're not going to do what the parent says. Okay? And parents, you are then going to put your child into a 5-minute timeout. We're going to pretend, for the sake of role play, that you have decided the chair that they're sitting in ahead of time was the timeout area. But I still want you to define for them the timeout area. So saying your timeout area is in this chair. If you leave your timeout area, you know, whatever. If you leave the chair, you're leaving your timeout area. And then we're going to do essentially a fast forward of time. So we're going to tell them it's a 5-minute timeout. You've already had the chance to review the rules with them ahead of time. We're going to say fast forward time, and that's going to mean 5 minutes passed. And then when your fast forward time is over, we're going to pretend that your child had been compliant and followed the timeout rules during timeout. So in essence, this will probably be the simplest timeout that you ever get to institute or witness ever. And I realize that. We're going to build up. We're going to get the mechanics first. And I expect when you're working with parents that you'll probably take a similar approach. Just like this is successive approximation towards implementing timeout effectively, you're going to walk your parents through successive approximation. So you're going to start them out with a relatively easy role play and work up to more difficult role plays with you as a therapist, and then start practicing doing that with their child. Okay, so this first one is going to go relatively smoothly. Kids, what I want you to make note of for your parents is, like we have been doing, what has been effective. But I also want you to make specific notes about things that they may be doing themselves to be aware of for when they turn around to model for parents, and also things that would be helpful hints for them to know in general for working with parents. So I want you to pay special attention to things like, do they really ignore you when you're in timeout? Or are they just watching and waiting for you to mess up in timeout? Now again, I know this is a contrived situation, so we're going to have to be somewhat flexible here. The other thing I want you to make note of is the type of language that they use, the way they deliver any of their language. So this again is a very easy one, but we will ramp up the intensity of some of our misbehavior to see what are some strategies that we should be advising parents to use during timeout. So a relatively tame one for this first one, but this is your chance to think about your language, your tone of voice, your behaviors during timeout. And kids, don't just be a passive kid. Use this time to think, what is it that my therapist, aka parent, is doing that is successful, that would help them to teach parents how to do timeout successfully. When we're done, we'll come back together as a larger group, switch, and do another relatively tame timeout, and then we're going to start ramping up the intensity of misbehavior to give ourselves a chance to practice how would we handle this, what's the long-term behavioral change we would expect, what's the long-term message. For those of you that may be doing this with adolescents, if you don't want to use the word timeout, but you want to use the word grounding or another consequence to practice it, that's fine. We're going to keep the role plays really brief though, just to stay with what everyone else is doing, okay? All right, so if you were the parent before doing the timeout, this time you're going to be the child. Again, we're going to do a relatively tame timeout, so it's going to be some more passive non-compliance. Before getting into that next role play though, kids, I asked you to not just passively be kids, but be making note of what worked effectively for your parent, aka the therapist, and what might be some important pieces of feedback for them to receive, to be aware of. So when they are guiding parents in how to do timeout, they can be their most effective. So before switching into new role plays, please take this opportunity to give some feedback if you've not done already. Keep it brief, no more than a minute. We'll come back together again, switch and restart. All right, so we're gonna switch role plays now. If you were the parent before, you're now gonna be the child. If you were the child before, you're now gonna be the parent. Children, you're going to need to, new parents, you're going to need to first inform your new child of what your timeout rules are so they know if they're making them or breaking them. If you've not done that already, some of you have, I know. And then we're going to do the same type of role play again. Give a command, non-compliance, reissue the command. When the kids don't do it again, you're going to issue the timeout. Again, paying attention to your tone of voice, language, etc. Kids, you're going to go to your timeout area, which is your chair. Fast forward time, having served your 5-minute timeout, and then parents, you can release them from timeout. Kids, though, please make special attention or pay special attention to the language, the words, the style, the mechanics of what your parent is doing, so we'll be able to give them effective feedback. Because this has been, as we said, the easiest timeout you'll ever do. They are hard, they're emotionally laden times when kids are going into timeout. And so we're gonna ramp up the intensity, and I can tell we have a pretty fun group of people here, so about to get rowdy. And I wanna make sure that you're feeling good about the language and the strategies that you're using. And we'll come back together, talk about those strategies, and then practice a more difficult timeout for non-compliance, okay? So in some ways, not in some ways, I'm very aware that this was not a naturalistic timeout, and I don't want to send the message that I thought it was in any way. But again, we're ramping up the intensity of timeouts with you as therapists. This may be a strategy to employ with parents, because oftentimes parents, when kids are being defiant or being disruptive, that's a very difficult time for them to manage. And it might be hard for us to set them up for going into that situation without stepping them through graduated exposure to it and then deconstructing what worked for you. So let me ask you, if parents go into a difficult situation with their child, what's some of their natural reactions to have? So if a child's in timeout and say refuses to go to timeout, or a child's in timeout and is really whining or really yelling hurtful things at the parent.
Get aggressive.
So some parents might get aggressive in response. So that sounds like the child misbehaves and then there's a physical consequence. Okay. What else might parents do?
Yeah, or getting higher.
So their voice might get louder and louder or harsher and harsher. So there's misbehavior and then there's verbal response.
Well, and I've seen the opposite happen too, where the parents' heartstrings are tugged and they want to console the child.
Okay, so misbehavior happens and then they try to have a heart-to-heart with them, so they're talking with them. So in each of these situations you've presented to me so far, we have a major misbehavior followed by some kind of attention. Yeah?
I think one of the worst is when parents are able to
when the parents are inconsistent, because it sounds like what can happen over time with inconsistency is it's sometimes you're going to get a reaction from me, sometimes not. Do we remember what inconsistent response is called behaviorally? Intermittent reinforcement. And we were saying yesterday how we know that's one of the best ways to maintain a behavior is with intermittent reinforcement. When we're first learning a behavior, continuous reinforcement really helps us to learn. But in maintaining a behavior, intermittent reinforcement is really what we want to go for. So yeah, it's tough when parents have sometimes will respond and sometimes won't, because what might be happening in the long run is we're really strengthening that disruptive behavior during timeout.
The other thing we're struggling a bit as a group is some of us tend to get into kind of a prelude before sort of getting to the steps and being succinct and outlining what the steps should be. We're doing a lot of talking, and I think some of it is a little bit of who we are as personalities.
Sure.
So there's one of us here, kind of our coach right now, that's really good about keeping us on task and not doing that. But
you get to the point already.
Nice kid role,
But it's trying to understand that. Is it because we're social workers, whatever, therapists, and we tend to process? Is it our personalities? Are there gender differences? You know, it's all these things.
And it probably the answer is it's all of the above. A lot of factors might contribute to why we want to talk through a tough situation. And it might be because for some of us, that's the style that we like. But from a behavioral perspective, what I want us to be aware of could happen is misbehavior, lengthy diatribe about why you're going into timeout, what timeout will look like until you finally get there. What in behavioral terms that might look like is misbehavior, attention, then withdrawal of attention. And I don't know that that's going to, for a child, send the messages clearly as misbehavior, withdraw attention. So it's just a point to consider. Now, I asked you as you were children to give feedback to your parent, aka therapist, on what strategies they used that worked well and what were points of feedback for them to consider and to take into mind for when they're coaching and advising parents. So what were some of those both good and constructive points of feedback that were given or that you received that's important for the group to hear?
In the beginning, she was kind of hesitant and she wasn't very directive. This is more assertive. And so I just said, you need to just do it. Go. This is And then at the end, when I actually did comply with the timeout and I completed the timeout, she actually connected the behavior, what got you here, made me think about what got me there, what was the behavior, I was hitting my brother. And then what I liked was that she made that connecting of the dots. Did you like timeout? No. Well, if you're going to continue hitting, you're going to end up having more timeout. So she made that connection. And I know we're more behavioral, but I'm a social worker. So then she kind of made that, when you hit your brother, you hurt your brother, So she kind of did that more connecting. But I just like that, but I thought it was good. I told her because it was right after the time after I completed, and she made that connection to what got you here, what was the behavior that got you there. It will continue to get you here if you continue to hit.
Here's a different way to think about it, because it sounds like from a behavioral perspective what I'm hearing. Misbehavior happened, you went into timeout, and attention was removed from you. Timeout was over, and even though it was processing, attention was given to you. So it may have sent the message to the child that you don't get my attention when you're in timeout. You get my attention when you're out of timeout. So it sounds like that might be, if there's processing to be done, after timeout might be the time to do it, because it's going to better connect. Timeout's over, you're back to getting attention again. You don't get attention when you're in timeout. The other thing I heard you say is there was maybe a lack of assertiveness in putting the child into timeout. Do you think some parents will struggle with that? Yeah. I've had a lot of, and myself personally, I've struggled with that a bit when I first started putting kids with disruptive behavior into timeout, because it can be an unpleasant situation. So I know a piece of advice that I had that helped me a lot was to almost think of it like I'm an actress and it was my script. And so I came up with words for putting a child into timeout. I came up with my script, and I would practice that in the shower. I'd say, you have a 10-minute timeout for repeated noncompliance. And it became, it helped me to take the emotion out of it, because I had practiced it so many times. And then I could just say, I went into timeout mode, or I went into actress mode when it didn't care if I was being called a hoo-hoo-hoo or, can fill in the blanks on your own. It allowed me to stay neutral and to move forward with that. So that might be an idea. Yep.
Something that helped me a lot when I was teaching was to say to the children, I'm so sorry you made that choice or that decision. So in my mind it was, because I was having trouble like you did in the beginning, and in my mind it was a way of saying to them, you're in control of this. I'm sorry you made that choice. Now we have to go to timeout.
So you felt like it kind of depersonalized the situation. It was the behavior, not the child.
Exactly. And
Okay.
it's, you're in charge, so you can choose to do this or not to do this. This is what we're going to do.
But it sounds like with that one statement, you were able to stop having a lot of conversation with them about it. It was just, that was it. Now you're into timeout. What were other pieces of feedback that people heard that will help the group? I know I heard a lot of neutrality, which I thought that helps to take the intensity out of the situation. What were you going to say?
I think you have to be firm, but I think your tone, your tone, the way how you speak to that child, because if it's like I was a real defiant child, and if she had come with me with a strong tone, she got it across, but with that nice, I don't know, gentle something was there. And I needed that, because if she had really come at me
Like
firm,
aggressively?
authoritative, no,
So it sounds like she was assertive but neutral.
assertive but very neutral. Really, yeah.
I think that's an
Made me
interesting
see,
point.
Made me see what,
Yeah.
But it was interesting to hear the feedback because I thought it was maybe a little bit on the authoritarian side where it needed to be a little bit more softer. So, because I think I felt guilt probably
Yeah.
in that moment.
And I think a lot of parents
And so
probably
when I
feel
heard
guilt
that
in
I
that
was
moment.
actually caring and nurturing, I thought.
Well, good. Nice piece of feedback then. And I think you're bringing up a larger issue, which is sometimes whether it's guilt or whether it's anger or frustration, the intensity of the tone in parents will change. So let me run through this line for a second. So misbehavior happens and we get strong intensity of reaction. Regardless of whether it's a lot of words, the intensity of the reaction escalates. So whether it's anger, frustration, guilt, the intensity changes. So misbehavior, strong intensity, misbehavior, strong intensity, misbehavior, strong intensity 100 times. What will that teach the child in the long run? I get a reaction, yeah. Or I get attention, or I get a reaction. So it sounds like neutrality, assertive neutrality. I like that phrase. That's one to keep in mind. Okay, we're going to run through this again, and we're going to allow some more misbehavior. But let's prep ourselves before we do that. So we're going to have misbehavior within reason. Nobody's going to be throwing punches or throwing chairs, but you can have a little more disruptive behavior. So parents, what are going to be some things for you to keep in mind about the disruptive behavior? As a parent, what should you keep in mind about how you respond to that disruptive behavior? Stay neutral. Stay calm.
Don't take it personal.
Not take it personally. Okay. What else would be helpful?
As long as it's not dangerous, you can allow it to.
Okay, so as long as it's not dangerous, you can allow it to go. And so we might want to work out with parents ahead of time what crosses that threshold of dangerous. Because again, in emotionally laden situations, if your instincts to react, your instincts to process, to talk, that's what you're going to do unless you have a plan ahead of time. Yep.
Staying focused, because it's easy to want to derail and start thinking, you know what, maybe I'm blowing this out of proportion. There's other priorities in life to take care of. Maybe I need to let go. So staying focused is critical.
So staying focused.
Less is more in the power struggle.
Okay, don't get into the power struggle, less is more. Okay, so all of these pieces of feedback that you're giving as a group, these will be pieces of feedback that you can help to give to your parents. So neutrality, less is more, stay focused, stay calm, don't take it personally. Because one thing we have to be mindful of as therapists is, let's say a child is non-compliant, they're given brief but neutral feedback to correct their behavior. They're non-compliant, they're put into timeout, behaviors, attention's withdrawn. They start ramping up the intensity of their behavior. And pretty soon it gets here and a parent reacts. What's just happened? So we might have taught the child that You just gotta get a little louder, badder, more intense, and then you'll finally get my attention. So the other thing I wanted to point out is, let's say the child goes into timeout and starts ramping up the intensity of their behavior because it used to get them attention. What's that called? Potentially an extinction burst. So extinction is when you remove the reinforcement that had been previously given to a behavior, in this case attention. So misbehavior happened, attention was given. Misbehavior happened, attention was given. We remove the attention, and sometimes kids will escalate their behavior because, hey, this worked for me before, I got attention before. So we may see some kids when timeout first happens, that's a typical time when we'll start to see an extinction burst. And we'll have parents react by saying, like, this doesn't work, or what do I do when they just keep being non-compliant and disruptive? What do I do? And sometimes the answer is nothing. They're in timeout. The answer is you would remove the attention, because what will happen over time is they learn in timeout that that's not how they get behavior anymore.
I think one of the hardest behaviors to deal with for parents, and this is
Bedtime?
you know, and when they put the child to bed and the child refuses to go to bed. And then the child's crying in their room or they're doing things and the parent just says, I just can't listen to that. I just can't let that go on. I have to go in and I have to do something. And it's really hard sometimes as a therapist to explain you cannot do that. Before you put them to bed, you have to make sure the environment is safe. And if they're up, okay, so they fall asleep on the floor. But the one thing that they're going to learn is they can cry. Good night means good night.
Yeah, which in some ways is, and now, though it's not putting kids into timeout, it's being firm with your direction. So good night, I've now withdrawn my attention. So you can escalate the crying, the getting out of bed, I need a drink of water for the 1,000th time, I gotta go to the bathroom one more time, all of those things. But for the parent, if you remove attention long enough, those behaviors start to extinguish. And I think you put that really beautifully. Let's break into our role plays, and I promise to come back to you. Let's break into our role plays. I'm gonna have you again decide who's gonna be parent, who's gonna be child, who's gonna be parent, who's gonna be child, etc. And children, you're allowed to be a bit more disruptive, whether that's refusing to go to your timeout area or more vocally complaining or name calling. We're not throwing chairs, we're not going to be aggressive, it's just more disruptive behavior. And parents, I want you to use your timeout strategies of withdrawing attention during those times, okay? And then we'll come back and talk about contingencies for how to deal with misbehavior. We clear on our directions? Good? I am excited to hear from the audience points of feedback that you're given, or critiques, or positives, so that way we can learn from each other. So I'd like to open it up to everybody. What was some feedback that you got that helped to make your timeout successful? Or what was some feedback that you got that will help you to improve your timeout implementation, and then vis-a-vis will help you help your parents in their timeout implementation? So what were some points of feedback that you heard that will benefit the whole group to share? Yes?
One of the things I'm going to implement right away is when they're being defiant and they're in time, withdraw my attention.
I know, it seems like in some ways it's a very subtle strategy, but I think what it teaches kids after a while is attention that I want to see, behavior that I want to see, attention. Behavior that I want to see, attention. Behavior I want to see, attention. Behavior I don't want, behavior I don't want, behavior I don't want, behavior I want to see, attention. Behavior I want to see, attention. And if attention is something that reinforces a behavior, then over time we see a shift in what kids are willing to do to seek our attention.
It was interesting. When I was doing the role play and I was playing the child, I was getting all revved up and having fun with being very defiant. And then she said, "Okay, well, I'm walking away," and I just literally was like, "Oh, well, now I have no fun." Because I'm not supposed to get overly defiant and like throw her.
Right. Yeah.
You know? So I was like, "Well, okay, fine. Fun's over."
That's so interesting. That's your reaction as an adult playing a kid. But it might be in some ways how our kids feel when in timeout, when they're getting your goat and getting your goat and getting your attention, and suddenly it removes it. It's like, oh, now what am I supposed to do? It was working for me before. Yes.
I thought about when I withdraw my attention that it was a timeout for me to continue to acknowledge the get up and activate it with the behavior.
Yep.
So I was like, okay, this is a timeout for me.
Yeah.
Okay, Bernie.
You do what you need to do. Yeah. That's funny. That's how I often think about it too, is it's like thrash, sweat, do whatever, yell, you're going to do. Have your temper tantrum. This is my, yeah.
Yeah, I think it also gives the parent, because sometimes one of the frustrations for the parent is they feel like they've lost control. And if they use things like withdrawing their attention, they get a sense of their own control rather than constantly engaging, which makes them feel like they're losing control.
Because what they've been trying to do previously is get control, and now you've given them a mechanism. So they're intentionally ignoring. This is not just an accident. I'm not just not being a good parent. I'm intentionally changing my child's behavior in the long run.
Yeah.
And you know, going back to what you're saying about giving the parent a timeout, for some of our parents that may be very emotionally reactive to a timeout because it's so hard for them, that might be a nice reframe of, once you've done your job of putting them in timeout, this is your time to calm down for you, or even giving parents some coping statements that they can say while their child's in timeout, like, I'm doing what I'm supposed to be doing, or this is my time to breathe, even though this is, you know, some kind of validating or coping statement to help them get through what can be a really emotionally riling time. What are other,
I think that, like, you're going, you know, and the timeout, so I think that's the control and empowering that parent to say, I do have control over my emotions. I can remove myself for a little bit from the child, and they're going to do what they're going to do. And then I tell, and somebody told me to do this when I was planning my wedding and job and blah, 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 and I count to 10 and go to your happy place. You know? Count to 5 if you only have 5 seconds or whatever. And just, I think that just the simple act of breathing for some parents, it's just, it's like always yelling, always this, always something. So I mean, even if it's that simple, I think that's good for the parent to like remove themselves and they can rethink how they're going to reapproach that child.
So it buys them that time to say, you know, am I doing, instead of just reacting, it buys them a minute to say, now I'm going to be proactive and I'm going to choose how I'm going to react to that situation. Other strategies or other pieces of feedback that were helpful to hear? Yes.
My parents used slow, controlled touch and pressure to bring me and keep me back in my seat. But it was slow movement.
Okay.
So it felt that they were highly controlled, although I was trying to spin them out. And the other thing that was really evident is I was trying to make a lot of noise, and they were ignoring me and even talking with each other about something completely different. I had to be quiet if I wanted to hear what they were saying.
Oh, that's interesting. So by efficiently removing attention from you by having a separate conversation or talking on the phone, if you wanted to even hear what they were saying, it caused you to be quiet.
Yeah, it was obvious that they were
doing it intentionally.
But I wanted to know if they were talking about me, so I had to be quiet to hear them, and then they could catch me being quiet, and time was over, and so on.
And so then it gave them the opportunity to say, I think the other thing that we'll want to keep in mind is, again, this is a contrived situation. And when you role play with your parents, that will also be a contrived situation, though you can work on escalating the intensity of the behavior, and you can help to model for the parent and then be that escalating child to role play. And they know that's a safe, contrived situation that they can practice their strategies. But one thing we haven't talked about specifically in the role plays are conditions that need to be met to end timeout. So helping parents to identify when timeout is over. So when it's signaled by a timer, or how they're going to identify when timeout time should be over. And then there are going to be some cases where a child's still so emotionally escalated or aggressive that ending timeout's not appropriate. So coaching parents on how to say, the timer went off, but you are still hurting or you're still hitting. The timer went off, but you're not sitting in your chair, so I'm resetting the timer for 1 minute. So what I would advise you to do is, because we know that these long, kind of protracted timeouts don't seem to work better than the shorter, briefer timeouts, to give parents a strategy like setting the timer for just 1 minute or 30 seconds, because the intent is to get the child to change their behavior for a short period of time, let timeout be over so the parent can re-engage and say, hey, you ended timeout. I'm really proud of that. Let's talk about why you went into timeout. but it provides that stark contrast between in timeout, no attention, out of timeout, attention. And if we get into these long battles with kids about how long your timeout should be, what may end up happening is I'm giving lots of attention to try to battle wills and to extend this timeout.
I think that's much more difficult for children that are cognitive because they want to engage you in a conversation, but sometimes the conversation can end up escalating again depending on how things are going. Whereas with some like population I work with, all I have to do is turn my head sometimes, which is as effective as a timeout.
Absolutely.
And when I have the desired behavior, I turn around and I go, I'm so glad, look at you know, that's so great. And then I can give the reward or withdraw the reward. Because for those children, it's so devastating when they're not getting any attention at all. But I don't have to explain it, and there's no conversation, it's just very primitive.
And for children with low cognitive functioning, that's oftentimes what a timeout looks like. It's not this whole scripted thing, but it's you hit, and you know, putting your head down or closing your eyes or just withdrawing your attention, and then, hey, I'm back. Let's move on now. And oh, you hit. And so what timeout can look like? I mean, really fundamentally, it's timeout from positive attention. We make it more of a scripted intervention for, like you said, kids that have cognitive abilities, but really the truth of it is just removing your attention following a misbehavior. Because for most kids, attention is a reinforcer. So it's just allowing us to use attention strategically. So again, I would really prep parents on how to handle when their kids don't end timeout right away, so they know again that they're doing something that allows them to be in control. The last thing is to reissue that timeout for not listening. So if they got into timeout because they didn't pick up their pen and put it on their book, to reissue that command and follow through again, to start to set the tone that you get my attention when you do what I say, not when you don't do what I say. I did want to make a point just to make sure we're thinking about this the same way. How many times do you think a child, specifically after they get out of timeout or given that direction, might go back into timeout? How many times do you think that could happen? Like, what might be a realistic? Could go on all night, 3 to 4 minutes. Depends on the kid. And I think managing managing time. I think one thing that might be helpful for parents is managing that expectation. It's particularly for some younger kids, it's not unrealistic that going back into timeout might happen in the double digits. So it might happen a dozen times. And that's frustrating and that's hard for parents. But having that expectation that this time it might be 12 times. Next time it might only be 8 times. Next time maybe it'll be 8 times again. But down the road, that's the routine, that's the procedure. We've taught them a skill, and if we've done our job of removing attention, we've also had all of those opportunities for learning of you don't get my attention when misbehavior is happening. You don't get my attention when non-compliance happens. I was working with a family with a 2-year-old, and we were working on increasing compliance. I know 2, but still we were working on increasing compliance and using timeout. And it was, you know, really not listening, not giving mommy the blue block, going into timeout. Timeouts were very brief. They were 30 seconds. As soon as she stopped crying, you know, timeout was over. Tried it again, and it was over and over and over again for this one really long session that we had. And so she probably went into timeout 9 times. And this, you know, I'm using this as an illustrative story because it worked out well. But then the 10th time, like, she got it. She listened to mom, she put it away. And since then, mom's had to do timeout 1 time with her. And I've known her now for, this has been 6-8 months since we did that really long practice together of going into timeout and not. And mom was saying that was really hard, but having a coach in the room to help me through that period of time to know I was doing it right. Now I know how to do it at home, and it's this totally not an issue anymore. Now again, I'm picking the story because it worked, because it's successful. But there are times where that can be successful. And again, having the value of having someone there support while trying to implement timeout can be the support parents need to make sure they are implementing it correctly.
And it's interesting when you say that. I can think of 2-year-olds where same scenario.
Mm-hmm.
And, again, the whole coaching is helping the parent stay neutral.
Yep.
And so on. This is practice time, practice
Mm-hmm.
for the child, practice for you. And the child then, maybe the next day, doing something exactly like what got them in the timeout and putting themselves in the timeout. And then being proud that they were in the timeout.
Timeout, yeah.
It's that cognitive component that sometimes,
Mm-hmm.
merges with this.
Yeah, and what I think ultimately, right, and our long-term goal for some of our long-term goal oftentimes is to teach self-regulation and self-control. And so even when doing it in a practice situation, if our long-term message is teaching the child that there's a consequence for that type of behavior and that they now know they have to go into timeout or cool down or listen, that's something we've taught
And
them.
then the big piece is to help the parent not to make that cute or not to fall apart when they see it. And
Yeah.
there's something wrong with my child. She likes timeout.
Yeah. Yep. Yes.
At what point would you tell the parent in assessing whether it's an effective
yeah.
or not? At what point would you tell them that when this isn't effective, we have to find another method?
Okay, and again, that's it's always going to be slightly different depending on the families, and I have my answer, but let me first ask the larger group. When do you help the parent make the decision that maybe this is not an effective punishment strategy for their family? And I think there are two different reasons why it might not be effective. It's not being done effectively, so parents really aren't ignoring the situation, versus this is just not a punishment procedure, meaning it's not making the behavior decrease. So let's go with the latter. It's not making the behavior decrease. How long do you anticipate that some of these strategies may need to be in place, predicated upon them being done correctly, for us to see that there's no change in behavior? Or how long do we need to try out a skill before we move on to something else?
About a week.
You think about a week? Okay, what do others think?
30 events.
30 events? Okay. What do others think?
I think it also depends on the nature of the acting out. Because we've seen situations where they seem to be ongoing, and so there's a chronicity about them. And where we've seen some kids where they've gotten so aggressive, that it's becoming a safety issue to themselves, to their siblings, to other members. They're destroying property, and they're doing that across settings. And those are, like with our kids, some of the typical, I hate to say residential kids that go that route
Sure.
over time. So I think safety certainly is a big piece.
Absolutely, and that would be part of the consideration of, is it being done effectively or can it be done effectively? Because you're right, there are situations we can't just simply withdraw attention because of safety. But saying that it's been implemented effectively, meaning implemented as intended, how many trials do we need to have before we say that this isn't working? So a couple things that I would consider is defining not working as no change in behavior, because sometimes the decrease is very slow. So if we're seeing any decrease at all, I would say, it's a slow change, but it's change. The other thing that can often happen is we see longer intervals of time in between when timeout happens, but the timeout's still really severe. So that can feel frustrating for the parents, and we need to go back and look at, are the periods of time in between which we have to use a timeout getting longer? Even if the timeout is still severe, that still may indicate that we're effectively dealing with the behavior. So if the duration in between, or the intervals in between when timeout happens hasn't changed, the frequency hasn't changed, then I would say that's the point where we decide this is not working as punishment. And I think 30 sounds pretty accurate. I would generally go with 20 to 30 instances. So if we have a child who only gets into timeout once a week, that's a really long period of time for us to assess, but then it may be, well, this is only a behavior happening once a week. This might be a skill a parent's learned, they can implement, let's try it out for a long period of time. If we're having multiple timeouts per day, and it hasn't produced any change in a week, well, then we've maybe had 20, 30 instances of it. So it's a balancing out. But certainly you don't want to stop using any strategy after it hasn't worked a few times. You want to look at both frequency and duration. Yes?
This is unrelated but related. If you were going in and doing a functional analysis, really set a baseline for behavior, how long would you do that for to determine that you understand the behaviors? Like how many days consider that?
Again, it depends on how frequently you see the behavior across days. So I would look at it more of frequency of behavior.
5, 6 times a day.
5-6 times a day for how many days? So when I'm determining, is this happening because the child wants attention versus access to something? Are they avoiding a task? How long do I look at the situation? You know, really from a more behavior analytic approach, baseline is assessed when you see stability in the response about 80%. It's not really across how many days or how many times per day, but how consistently are we seeing that response? So if we're seeing aggression happen because a child's trying to get something, so trying to access something, and we see that consistency and access about 80% of the time we're looking at it, then we have a sense that that behavior is driven by access. So that's kind of tough to answer in terms of how many days with how many times per day.
The reason why I asked is
Yep.
I spoke to a family today, and they said to me that they brought in a behavioral analyst into the home, and I said, that's great, I'm really excited to hear that. And she said, well, it's going to be probably 60 days before we can get started. And I said, why is that? And she said, because they said they have to analyze the situation, to track the behaviors for 30 days, and then it's going to take another 30 days for them to come up with a proper behavioral plan. So 60 days, and I'm thinking to myself, in 60 days, the behavior is so out of control now. These people need help right now.
Yeah.
That just isn't making sense to me.
Yeah. Well, and you know, having no more knowledge of that situation than you do, it's not certainly I want to, you know, comment on. Really what we look, when we're talking about functional behavior analysis, it's sometimes behaviors happen for a variety of reasons. A lot of times it's attention driven, but sometimes it's to get access to something. So I might be aggressive towards you because I want your toy, versus I'm going to be aggressive towards you because I want to get your attention. Or I'm going to be aggressive for you so I can get away from you because I want to avoid the situation. So there might be sometimes different functions or reasons that a behavior occurs. And what people do in a functional behavior analysis is try to figure out the reason why a behavior is happening to target the reason rather than just targeting the behavior. So that's what we're asking about now. So from a functional behavior analysis perspective, you look for stability in the reason why to choose that's what's happening. But sometimes with really complex behaviors, there's a lot of reasons why, or there's so many varied situations that it's hard to get a handle on things. So that's a tough one to give an answer to with right now.
Hopefully,
I don't know if that was a great answer. Yeah.
the behavior analyst is setting the stage for all of the, how do you say, alternative desired behaviors to be occurring, and maybe working on those before addressing consequences for the undesired behaviors.
Yeah, hopefully, absolutely. And certainly there are some very skilled behavior analysts, so they can do really beautiful work. All right, let me pause for a second. What we've gone through so far is explaining social learning theory to families, increasing the opportunity for showing interest in children's lives, and increasing attention, then strategically using attention in the form of physical reward or verbal reward, aka labeled praise, catching your child being good. We've also integrated the concept of planned ignoring or strategically withdrawing attention from behaviors that we don't want to see continue. We've talked about the pre-MAC principle, or using a higher likelihood behavior to motivate a lower likelihood behavior, aka when-then. We've talked about how to give effective commands, so how to set up antecedents to produce more compliance, and house rules, which is also a form of antecedent to set up or to set the stage for more compliant behavior. And then we've moved into how to effectively use timeout to withdraw attention from inappropriate behaviors and start to reduce non-compliance and disruptive behaviors from happening, or reduce their likelihood of happening. So those are the skills that we've gone through so far. And in some respects, when you look at behavioral parent training components, these are the 6 components that seem to have the highest level of commonality across programs, so kind of the essential ingredients that are included in most programs. What we'll be shifting into are more intensive behavior plans, like how to set up a point system, how to use a daily report card, how to use a response cost system. But what I want to emphasize to you is that after working through these skills and trying out the application of these skills, for some children, this is sufficient to improve their relationship with their family, sufficient to improve the behaviors that they're demonstrating, or parents are at least on a positive track with that. So it might not be where they want them to be, but there's movement in the direction that they want to see. And one of the bigger pieces of information that I felt like I took away from our first day was that in some ways, a lot of the components of interventions that have been found to be successful, or a lot of the interventions that have been found to be successful across children's mental health, are simpler, easy to implement strategies. So I, in general, am a proponent of, if something is working, let's not make it more complicated than it needs to be. Let's not make it harder for parents to implement. So what I would ask you to do when you're working with families is, after, of course, each session, to take pause and assess, are things getting better? Is my family functioning better? But certainly after we get through timeout, to take pause and say, do we need a more complicated system right now? Or do we need a more intensive system in the form of a daily report card, or a response cost system, or a point system? And if the answer is, my family's making progress, we may move into what we call maintenance, or supporting families as their children continue to change and their family functioning continues to get better. If parents do feel like they need something more intensive, that's where we would move into doing a daily report card, or a response cost system, or a point system, which are in sessions 7, 8, and 9. But again, I just want to urge that in terms of maintaining behavioral interventions in the home, I do think that sometimes parents can struggle with maintaining complex point systems, or maintaining more complex or intensive behavioral charts. That's not to say we shouldn't use them when warranted, but I guess I'm just emphasizing that if this is sufficient for parents, there's not a necessity that we make it more complex than what it is. Okay? So this would be a nice opportunity for you to stop and assess with your families, how are things going? Yes?
Do you start to get into, with the improvement of behavior, helping them to switch over to intermittent rewards in order, you know what I mean? Do you start to do that also?
Yeah, I think that's a decision to make. So if you're seeing positive change, things are getting better, or you've seen kids learn a skill like being better listeners, I think it is appropriate to share with parents, where do we see them at? How frequently are they listening to what you say? As soon as they're listening to what you say, probably 8 times out of 10, it means they've mastered a skill, or even sometimes 7 times out of 10, they've mastered a skill. So if parents are still saying, yeah, listening is getting better, but flip a coin as to whether he's going to listen or not, we need to still be in continuous reinforcement. But once it becomes a bit more natural, that's when, yes, we can start integrating more intermittent reinforcement, or not praising it every time, not providing attention every time, but making it more of a naturalistic routine. That being said, is sometimes when we do that, when we start to withdraw the intensity of the attention or the frequency of the attention, the child says, wait, what? Hold on, I used to get attention for this, let me do something else. Or we start to see some backslide in their behaviors, and just normalizing that for parents and saying, okay, maybe this is a behavior we need to monitor a little longer. We need to keep up with continuous reinforcement until it becomes more of a pattern. But yeah, I'm a big proponent of, we don't need to make it more complex than it needs to be if we just need to play with maybe a reinforcement schedule.